Healthcare is a right, and yet not everyone has it. Some have great health care. Some have insurance, but it's expensive. Some find coverage unaffordable. Some have Medi-Cal, but struggle to find care, and some have nothing. We all know how complex our healthcare system is, but I do not see a silver bullet on the horizon. Aspirationally, yes. Realistically, no. So what's to be done? It's going to be a journey, but we need to know how to plot our course. That's why I and my colleague, Dr. Arambula, have a bill that creates a process to build a roadmap to the goal, universally public-funded health care. The bill creates the Advisory Panel on Healthcare Delivery Systems and Universal Coverage within the California Health and Human Services Agency, an independent panel that will develop a plan that includes a timeline of the benchmarks and steps necessary to reach the goal. As co-chairs of the Assembly Select Committee on Healthcare Delivery Systems and Universal Coverage, we convened a number of hearings beginning last fall, more than 30 hours worth, to hear from many well-respected experts about where we are now, where we need to go, and how to get there. As we dug deep into this complex policy issue, we recognize that to be successful, we must define a pathway that addresses a number of issues, including challenges related to state and federal law. Medicare is funded through a protected Medicare trust fund, and federal law establishes the rules for how that money can be spent. Accessing those funds would require congressional action. Prop 98 amended the Constitution to require 40% of state general fund revenues go to K through 14 education. How will Prop 98 affect new revenues brought into health care? The GAN limits from Proposition 13 and 4 amended the Constitution to impose spending limits on the state to ensure that revenue in excess of those limits would be returned to the taxpayers. What can be done about that? Currently, 3.3 million Californians get coverage through self-insured or self-funded plans that are subject to ERISA, administered by the U.S. Department of Labor. They are exempt from state-specific health insurance regulations and therefore could not be combined into a single system. In addition to federal and state statutory challenges, any meaningful change to the current system must have a mechanism to predict and manage several things, including the extraordinary rise in healthcare costs, the existing and predicted shortages in physicians and allied health professionals. And finally, we need a multi-year financial model that includes state budget implications, an assessment of options for raising revenues and managing costs, an identification of the size and potential revenue sources for a prudent reserve, a stakeholder engagement and analytical process to develop covered benefits, eligibility, service delivery, provider payments, and quality improvement. We need to establish a data collection and reporting system to support management, evaluation, transparency, and public accountability. We need recommendations to build an IT system and a financial management system capable of administering a universal and unified publicly financed healthcare system. We need a feasible financing system and analysis of the need for voter approval of any funding mechanism. This bill provides the roadmap, the map, and the path we need to move forward, and I'm asking for your support.
Move the bill.
Thank you.